Okay, looks like we're looking at our patient Cam Casey today. He is a male. He was born 12919XX. He's a full code status, and I am going to look at his current orders. He has an order to insert a nasogastric tube, and then it's going to be connected to low continuous suction. That order is active and due now. Today we're going to be inserting the nasogastric tube, and then we're going to connect him up to low suction after we confirm with an x-ray. So I'm going to coordinate with radiology to set that up once I insert the NG tube. I'm going to look at his most recent vitals, make sure he's in good shape. Looks like everything seems to be a bit elevated, but he is currently rating his pain at a 7. So that explains a lot of those vitals, and we'll reassess once we get in there. Looking at his allergies, it looks like he doesn't have any known allergies. And then these vital signs were taken 15 minutes ago by the CNA. So we're just gonna assess his overall status, but we don't need to retake those vitals. Looking at his current assessment data, we're gonna focus on his respiratory status and gastrointestinal status. Looks like he is breathing fine, it's regular rhythm, clear bilaterally, he's on room air. And it says his breathing is labored with activity, but at rest it is regular, even, and unlabored, which is good to hear. I'm going to look at his integumentary status really quick. It looks like he is flushed and diaphoretic. His skin turgor is recoiling immediately, which is good. It looks like he is having some yellow crusting of the skin on his abdomen in between his skin folds. So we're having a little bit of a moisture issue there, so we'll want to keep out for that when we're looking at his abdomen. And I'm also going to look at his gastrointestinal status. His abdomen is soft, distended, and rounded. He has hypoactive bowel sounds in all 4 quadrants, so I'll look for that once I'm in there. And he is having some generalized tenderness and nausea, and last night he did have an MSS after eating dinner, so I'll ask him about that. He has not had a bowel movement in 5 days, so I'll ask him about his bowel movements. I'm going to go ahead and gather all of my supplies for the NG tube insertion, and let's go see our patient. No.
Come in.
Hi, my name is Ella. I'm going to be your student nurse today. How are you feeling?
Not well.
You're not feeling good? I'm sorry to hear that. What's going on?
Pain in my abdomen.
Oof. We'll definitely want to get that taken care of. But can I have you just confirm your full name and date of birth for me?
Yeah, sure. My name is Kim Kelsey, and my date of birth is 1/29/19XX.
Okay, that does match what I have on your armband here. Before we go any further, I'm just going to provide privacy. And do you have any allergies at all?
Not that I know.
Not that you know? Okay. How about food or med allergies?
Nope.
Maybe environmental or latex allergies?
No.
Maybe betadine, iodine, or adhesives?
No.
Okay, wonderful. Okay, so I was just taking a look at your chart, and you said that you were experiencing a bit of pain in your abdomen. Is that correct?
Yes.
Okay, I'm so sorry to hear about that. Can you tell me about how long ago the pain started?
Well, since yesterday, and it's been like in the lower part of my abdomen.
Okay. And if you could rate that pain on a scale of 0 to 10, 0 being absolutely no pain and 10 being the worst pain you've ever felt, how do you think, where would it lie there?
Well, right now it's 7 or 8.
Maybe 7 or 8. Okay, so would you say it's been getting worse?
Yes.
Okay, all right. And the type of pain that you're feeling, would you say it's stabbing, throbbing, achy? How would you say?
It's sharp, definitely. It's really painful.
Okay, kind of sharp, stabby. Okay. All right, well, we'll definitely want to get that taken care of. And is it localized to that one area, or is it radiating anywhere else?
No. Now it's just in that lower part of my abdomen that I said, yes.
Just in the lower part of your abdomen, okay.
Yeah.
I saw in your chart that your last bowel movement was 5 days ago. Is that correct?
Yes.
Okay, so we do think that the pain that you're feeling is likely you might have an obstruction or something going on in your intestinal system, which is why you're feeling that pain as bad as you are. So today we are going to give you an NG tube or a nasogastric tube. Do you know what that is?
No.
Okay, so a nasogastric tube. What happens, it's a long tube that we insert up your nose and down your esophagus, past your pharynx, and into your stomach. And we kind of bypass all those other, your mouth and your nose. And so we can deliver nutrition directly to you. That's how you will receive all your nutrition and hydration.
Okay.
And then we also have an order to hook you up to low continuous suction. So we're gonna get everything out of there that doesn't need to be in there and hopefully relieve some of the pressure, make it a little bit easier on your intestinal system, okay?
Okay, good news, finally.
Okay, yeah, exactly. We want to make sure that you stay hydrated, that you stay nutritionally intact. With this, you cannot have anything by mouth, so you can't eat anything or drink anything like normal because everything will be delivered to you through the tube. So that's something after we insert this tube, be sure not to eat anything or drink anything, okay?
Okay.
Okay. And then before we go any further, before I get into the procedure, I'm going to do a bit of some assessment questions. I just want to make sure that you're a good candidate to receive the NG tube today, that inserting it would be appropriate. So I'm going to ask you some questions just about your GI system as well as your respiratory system. Does that sound okay?
Yeah, fine.
Okay, and I'm talking down to you a little bit, so I'll raise you up just a little bit. All right, and we can keep you in this high position for now. Okay, so starting with your respiratory system, do you have a history of a smoking or alcohol use?
No.
Okay, all right. The smoking is the one we definitely we were looking out for there. Would you say when we talk about your daily life, what would you say your activity level is like?
Not too much. I usually work in an office, so basically I spend all my day there.
Okay, okay. Would you say that do you get short of breath easily, or are you really good there?
Well, when I try to do exercise, yes, I have like some sort of breath.
Okay. From day to day, do you get out of breath from doing day-to-day activities like walking up the stairs or maybe getting up in the office and walking across the building? Does that make you out of breath as well?
Okay, so walking across the building, no, but when I need to go for the stairs, yes.
Okay, okay. I just want to get a good feel of where you're at there. Let's see. Do you have any issues swallowing at all?
No.
Okay. Is breathing in is it especially tedious for you? Is it painful at all?
No.
Okay, wonderful. Okay, and then as for your GI system, you said your last bowel movement was 5 days ago. When you had that last bowel movement, was it hard? Was it soft?
It was hard to push, and I did too much effort, and it just was like a small amount of feces.
Okay. What color was it? Did you see any blood in there?
No, it was just hard to push.
Okay, okay, good. Okay, it's good that you're not having, I'm sorry that you're having that issue. It's good that there wasn't any blood in there though. Would you say that that is in the norm for you, or a lot of your stools like that?
Hard to push?
Yeah.
Yes. I mean, I've been constipated before. It's just like, I usually just handle it with some medications and it works, but this is the first time that it really is not working. I mean, I tried to buy some laxatives, but it didn't work, so that's why I'm here, because I still feel the pain right there.
Okay. So you've been managing it up until this point, but it's right now it's kind of getting out of hand. Does that sound all right?
Yes.
Okay. All right. What does your diet look like on a day-to-day basis?
Well, I'm really busy, man. I have too much things to handle daily, so I don't have enough time to cook or do that kind of stuff. So I usually just order food. Fast food is my best option.
Okay. Yeah. I mean, especially with how busy work can get, sometimes it can get like that. Okay. So now that we've talked just a little bit about your GI and respiratory status, I am going to do a physical assessment. So I'm going to listen to your lungs, listen to your bowels. I might palpate your abdomen just a bit. I'm going to leave you sitting up. Is it okay if I listen to your lungs a bit?
Yeah, sure.
Okay, sounds good. Okay, so first I'm going to listen to your lungs. So every time you feel my stethoscope move, I'm gonna have you take a big deep breath in and big deep breath out. I'm just gonna clean the head of my stethoscope here. And I'm also just gonna perform hand hygiene before we start as well, before I touch you. Okay. All right. And remember, I want you to take a big deep breath in every time you feel me move, okay?
Yeah, sure.
Wonderful. Okay, so you're sounding pretty good for right now. Do you mind if I sit you up and I can listen to your lungs from the backside?
Yeah, sure.
Okay, so what I'm gonna do is I'm just gonna tilt you forward here a little bit.
Yeah,
so
I
you
will
might
need
feel
help.
just
Yes,
a little
thank
bit
you.
uncomfortable. All right.
Okay.
And I'm gonna have you do the same thing every time you feel that deep breath in. Every time you feel my stethoscope, I'm gonna take that big deep breath in and out, okay?
Okay.
Okay. I'm just gonna put my stethoscope back here. Okay, everything did sound good. I didn't hear any crackles or anything like that. I'm just gonna look at your chest really quick. It doesn't appear that you're breathing with any accessory muscles. Looks like your breathing is even on both sides, and I don't hear any laboring in your respirations either, which is good. Okay, and I'm also gonna lay you down flat. I'm gonna do a GI assessment. I'm gonna inspect your abdomen. So at first I'm going to listen to your abdomen just like I did your lungs, and then I'm going to use my hands and I'm going to palpate the abdomen, okay?
Okay.
You might feel some discomfort during that process, but I'm gonna try to do it as gently as I can. Do you mind if I move your gown and blanket?
No, go ahead.
Okay. Okay. Okay, just gonna access the abdomen here. Okay, and I am seeing some yellow crusting from some moisture here. So I'm just gonna perform hand hygiene and put on some gloves. Sometimes these gloves are a little bit more stubborn than I like them to be.
Yeah, I see.
Okay. All right, I'm gonna start by listening to your abdomen. I'm gonna start in the right lower quadrant here. Okay, and I'm gonna listen for 1 to 3 minutes here for each quadrant. I'm noticing those hypoactive vowel sounds, so I'm gonna keep listening for 1 to 3 minutes in each quadrant. Okay, it does sound like you are exhibiting those hypoactive vowel sounds, which is consistent with that constipation that you're feeling, that you're experiencing. Not everything is moving along just quite as it should. I'm also going to palpate the abdomen here, so you'll feel some pressure. All right, you just tell me when you feel any pain, okay?
Okay.
You feeling some
yeah,
pain?
there, yeah.
Okay, all right, it gets worse there. Okay, all right, I'm gonna go ahead and cover you back up, and I'll go ahead and dispose of my gloves here. Okay, you did a great job. So it looks like you are a good candidate for this NG tube. I'm gonna also inspect just your skin really quick. And it doesn't appear that you're cyanotic at all. It looks like you're breathing well, perfusing correctly. I do see that you're a bit flushed and diaphoretic, but that's likely because of the pain that you're experiencing. And then I'm also going to look at your skin turgor and also your cap refill, just to double check with that perfusion. Do you mind if I touch your hand here?
Yeah, sure.
Okay, so I'm just gonna check your skin turgor, make sure everything's recoiling as it should, and it is. It's recoiling immediately. I'm also gonna check your cap refill, and that is less than 3 seconds as well, which is good. Okay, all right. So we are all set to go ahead with the NG2 process today. I am going to have you do I am going to just inspect your nose and your mouth really quick. So I'm gonna look up your nose here with my handy dandy pen light, and I'm not seeing any sort of irritation, any polyps, any bruising or bleeding in either cavity, which is good. I'm gonna use my tongue depressor here. All right, do you mind if I stick this in your mouth?
No, go ahead.
Okay, I'm just depressing your tongue here, looking back there which is good. Have you had any nasal surgeries or gastric surgeries?
No.
Okay, and when I was looking up there, I did not see yet you have a deviated septum, which is good because we're about to put something up your nose. Okay, so we are all set there. I'm going to do a quick respiratory assessment of your nares. So I'm going to put my finger against each of your nostrils, and you're going to breathe through the opposite one. We're going to see if either one is stronger, okay?
Okay.
Okay, right. Okay, I'm noticing that this left one is just a bit stronger, so we're going to do it through that one today. Okay, and just to confirm, have you had any issues swallowing at all?
No.
None? Okay, good. Good to hear. I'm going to get all of my supplies ready here. Okay, so during this process, we're just going to, afterwards, we're going to provide oral care. So we're going to quickly develop just some signals. This process is not comfortable at all. It's definitely something, it's not something that patients really like doing because it is a long tube that's going up your nose and down your esophagus into your stomach. So, but one thing that we do want to be on the lookout for is if you're experiencing any intense pain. If you're feeling any pain, I want you to please raise your hand and then raise your right hand, and then I'll know to stop and give you a minute, and then we can decide whether or not I can proceed with the procedure, okay?
Okay.
Okay, wonderful. All right, I'm just gonna get all of my supplies here ready. I'm gonna hand hygiene. I'll get my tapes ready here. We secure this to your face using some tape. First, some temporary tape to confirm placement. After we confirm placement by aspirating your pH, by aspirating some stomach juices and then testing the pH of those stomach juices. So, just gonna get a few pieces of tape here ready, just to make sure that we are all set. Okay, I do have oral care ready for you. During the procedure, I am gonna have you sip on some water. That's just to help the tube go easier down. And then partially through the procedure, when the tube reaches your pharynx, I'm gonna have you tilt your head forward. That just prevents it from going somewhere that it shouldn't. We want it to go down into your stomach and not anywhere else, okay?
Okay.
So I'm just going to grab my tube here, the package. Before opening it, I'm gonna look at it, make sure it's in good condition, that it is in date, it has not been opened previously. And I'm just gonna go ahead and open it. Okay. And I am going to measure this by taking the tip of this tube here. It's a really long tube. Let's see, there we go. I'm gonna take the tip of this, I'm gonna measure it from your nose to your ear. And then once I have it around your ear, I'm gonna measure down to your xiphoid process, which is the base of your sternum here. And it looks like that is going to be at 55, so that is where we're gonna place our tape. This is how we know how far to advance to the tube into your belly. So now that I have that ready, I'm just gonna set it down really quick on my supplies, making sure it's not touching the table, getting dirtier than it needs to be. I'm gonna go ahead and lay this towel on you really quick. This just prevents you from getting messy during the procedure. Okay, and it looks like you are in a high Fowler's position, which is about 45 degrees. I will say that after we insert this NG tube, that we cannot have you be in a position lower than 30 degrees. Right now you are at a high Fowler's position, which is 45 degrees. But we can't let you go below 30 degrees after the tube is inserted, just because we don't want you to aspirate, and that mitigates your risk for aspiration there. And then, as I mentioned earlier, you cannot have this after we insert this tube, you cannot have anything by mouth. We call it NPO status. And that is because you'll be getting all of your nutrients and everything from the NG tube, all of your everything in hydration.
Okay.
And then you will also be put on a fall rest because you will be hooked up to that continuous suction after we confirm placement with x-ray. So if you do need to get up, if you need to go to the bathroom, or if you just need to get up to walk around, please hit your call light and we'll have somebody come and assist you with that, okay?
I don't think that's why that is necessary, but okay.
Okay. We're just trying to look out for you best we can, okay? Okay. Make sure everything is set up over here. We're gonna lubricate the tip of this just to make sure it's completely, it makes it a little bit easier to go in. So we're gonna lubricate the first 2 to 3 inches of the tube. You got it dripping a little bit, so we're gonna try not to have it drip all over your nice gown there. Okay. All right, it looks like we are ready. I'm gonna give you your water to sip here.
All right.
Remember, I'm gonna have you be sure to sip that so that way it's a little bit easier to advance down your esophagus into your throat there, okay?
Mm-hmm.
Okay, so there's your water.
Okay.
Okay, and then also remember that when you are, if you feel any pain, please just raise that right hand. Like I said, not going to be a comfortable procedure, but if you feel that sharp pain, then make sure to raise your hand, and then we can stop the procedure and decide if we can go further. Okay?
Yeah. Okay. Just do it.
Okay. All right. All right. I'm gonna count to 3, and then I'm gonna start. Okay?
Okay.
1, 2, 3.
Oh.
Okay, I'm gonna start sipping water and I'm gonna tilt your head down to your chin to your chest really quick.
Okay.
Okay. I know. Good job sipping your water. You're doing really good. It's a really uncomfortable procedure. So. Okay. Yep. There we go. Okay, let's see here. Okay, looks like we got that tube all the way in, so I'm gonna go ahead and secure this just with a piece of tape here. Call this a piece of pants, and we put it right here on your nose, and this is your temporary it's a temporary taping just until we confirm placement by aspirating your pH juices or your stomach juices.
Okay.
Okay. All right, it's nice and secure there. Okay, so now I'm going to go ahead and aspirate those juices and test the pH of them. So we're going to remove this. You did a great job. And you're still feeling okay?
Yes, it's just like weird.
Yeah, I bet. Okay, so we're going to aspirate these stomach juices, and we're going to take about 5 mils. And come over here. I'm going to take those out. All right, we'll go ahead and test the pH on those. Okay, I'm going to check it against my guide. It looks like this is at a 4, which is appropriate. It looks like we are in the right place, so we are in the stomach. Okay, so I'm going to go ahead and permanently attach this to your nose. So what I'll do is I'm going to apply a skin barrier here, and this just keeps your skin from getting irritated. I'm going to apply that just on the sides of your nose, and we'll put on our other piece of tape here. Okay. And then we do ask now that we've got this, and that you do not take out the tube because first of all, we don't want to damage your throat or your esophagus or anything. But then also we want to make sure that it's in the right place after we confirm with x-ray, okay? So now that we've confirmed placement, I'm going to use my marker and I'm just going to mark where it is at your nose. That way if it moves, then we know. Okay, I'm going to go ahead and take off my gloves here. Perform hand hygiene. And we're going to go ahead and perform oral care. Is that okay?
Yes.
Okay. I'm going to quickly put on some more gloves. Okay, going to, okay. Okay, I'm gonna get around the back of your teeth. I'm gonna get on your tongue. I'm gonna get towards the front and the back. Okay, and I'll have you spit. Perfect. And then you can go ahead and take a last sip of that water, and then since you're in pee, I'll have you spit again, okay?
Okay.
Perfect. Okay, I'm gonna go ahead and gather up all my supplies here. We're gonna remove that towel from you, and we'll go ahead and pin it to your gown as well. Okay, we're gonna dispose of this in the linen, and we'll pin this to your gown. Let's see, grab my piece of tape here. Okay, all right, it looks like we are all set. I'm gonna go ahead and gather up all of my supplies. I'm gonna dispose of everything according to facility policy. Okay, and if you need anything, please be sure to hit that call light, especially since you are a fall risk. We're gonna confirm with x-ray the placement. I'm gonna go set that up with radiology right now.
Okay.
And then if you need, and then after that, we will hook you up to that low continuous suction. I'm gonna go ahead and steal your water since you are NPO. Okay, and I'm gonna give you your belongings back. We're gonna lower you down to the lowest position here. I'm gonna take my computer. I'm gonna assess for safety. I'm gonna give you your call light. I'm gonna make sure that your bed is in the lowest position. I'm gonna keep you at 45 degrees. And remember, you can't go below 30 degrees. And if you need anything at all, please just let me know, okay?
Okay, thank you.
All right, you have a good day. Bye. I'm gonna remove privacy.